Okay, welcome everyone. Thank you for joining us. I bring you greetings on behalf of the Emory Goizueta Alzheimer's Disease Research Center. We're so pleased to have you here. This is the final installment in our three-part lecture series to address men's health. So for three consecutive Wednesdays, we've been talking about health issues and things that concern men, and specifically men of color. So you've heard from experts about prostate health, brain health, and even heart health. So today, you're in for a great treat. You're going to hear from many of our experts, our partners, that just have an amazing amount of expertise and talent today. So sit back, listen. You can also submit your questions in the chat or the Q&A. This session is being recorded. And with that, I want to welcome Dr. Allan Levey. He is the chair of neurology, and he's going to talk about our mission today and introduce Dr. Parker and Dr. Law. And then Dr. Parker is going to introduce Dr. Aaron Anderson. He's going to introduce the rest of our esteemed panel. So as I mentioned, we welcome your questions, your comments. We thank you for joining us and invite you to sit back, tune in, and enjoy the session today. Dr. Levey?
Thanks so much, Cornelia. As always, you've done a great job with organizing everything we do. So thank you for putting this together for us in advance. So just a few words, introduction today so we can get started. This is obviously an unprecedented time for us with this global pandemic and the recognition of systemic social injustice. Our Emory Goizueta Alzheimer's Disease Research Center, we remain committed to the inclusion of all populations in our search for a cure for Alzheimer's disease and related disorders. We're now entering our 16th year as one of the national Alzheimer's disease research centers. And it is our mission to continue to enhance research and training to enable early detection, early intervention, and ultimately we have to get to prevention of Alzheimer's disease and related disorders. Throughout our 15 years of existence, being based here in Atlanta, we have made it a priority to contribute to the national goals of our national network. And we have a special responsibility here to have a special emphasis to address concerns that African Americans are underrepresented in Alzheimer's disease research. Our own research and many others has shown that African Americans are underrepresented. It's increasingly concerning as we look towards treatments in the near future, that we need to be able to diagnose early and make sure everybody has access to treatments as they become available. We've seen that African Americans have a 64% increased incidence of Alzheimer's disease and a 56% increased prevalence compared to Caucasians. And those are data that are similar to what our neighbors at the CDC have found as well. Death rates continue to be significantly increased for African Americans with Alzheimer's disease. And we know that in this pandemic, those vulnerable people include both African Americans and people with Alzheimer's disease. So it's an unconscionable double whammy. There's delayed diagnosis and reduced rates of treatments for African Americans as well. And lastly, our own research has recently shown that even the new biomarker tests that are being developed to help early detection show that there are racial differences in how these biomarkers perform. So as a first step, there's a really important urgent need to increase participation of African Americans in research. So we've embraced this challenge at the ADRC to increase recruitment and participation of African Americans. The people you're going to hear from, including Monica and Jim, have been very successful in helping us increase our enrollment. Over the last 5 years, we have 1-to-1 African Americans and Caucasians who have been recruited into the Alzheimer's Center. And for over a decade now, our leaders, we continue to work to build your trust through trustworthy actions and engagement with us. And our group has done a great job having many events throughout the community in the region. In fact, 66% of individuals over the last 5 years have been underrepresented minorities. So we're delighted to launch today the final part of this three-part series of webinars, The Path Forward. I can't thank our esteemed panelists enough. We have been incredibly fortunate to have leaders from the country in our own home and continue to be inspired by them. So with that, let me turn this over to Dr. Monica Parker and Dr. Jim Law. Thank you both. Dr. Parker is director of our Minority Recruitment Corps, which we're delighted is now a firm leading part of our Alzheimer's Disease Research Center, as we just went in through the renewal. And Dr. Jim Law runs our Clinical Corps, which is responsible for recruiting subjects and getting them involved in research activities. Monica.
I'm there. I'm unmuted. I want to thank everybody who's agreed to be a part of our panel today. Thank you so much for agreeing to participate, and more importantly, for your support of our Goizueta Alzheimer's Disease Research Center. Thank you for all of the audience members and partnering organizations who are contributing to our outstanding educational efforts. The Minority Engagement Corps has been funded, quite frankly, through the National Institutes of Health because we had spent a considerable amount of time educating and recruiting and informing people of the Atlanta community, not just African Americans, but Latin Americans, Native Americans, and other people, anybody who's underrepresented. Underrepresented includes not only females, but more importantly, males. Whether you're green, purple, black, white, or polka dot, we need more males engaged in our ongoing neurologic studies. And one of the things that we were told was that if we knew more about how to participate in research, if we knew more about what Emory did, we might be more interested in participating. We have heard you, we've partnered with people in the community, we've gotten buy-in from our colleagues at Morehouse School of Medicine, as well as people in other research centers around the country. At this point in time, I'd like to say thank you to Drs. Allan Levey and to Jim Law for promoting and supporting diversity in neurologic research. We set an example for the rest of the country. At this time, I'd like to introduce you to Dr. James Law, who is director of the vice director of the Department of Neurology and director of our clinical core here at the Goizueta Alzheimer's Disease Research Center. Dr. Law?
Let me just add my welcome and say that I don't really have anything to add to what Dr. Levey and Dr. Parker have already said, and I don't want to take any time away from our amazing group of panelists. So I'm going to hand this directly over to Dr. Anderson, who's one of our faculty members here in the neurology department, who has been taking a lead in developing better processes for us as a group, for the department as a whole, to improve our diversity and engagement across our systems. So, Aaron.
All right. And thank you very much, Dr. Levey, Dr. Law, Dr. Parker, and definitely want to say thank you to all the panelists that have agreed to join us for this conversation today about the path forward towards equity. And equity, not just with healthcare, but with research in order to help improve that goal towards equity with healthcare. We have a fantastic panel. I definitely want to thank Ambassador Young for joining us. We have former Surgeon General David Satcher, Dr. Satcher. We have the current president of the American Medical Association, Dr. Patrice Harris, joining us on the call. We have Dr. Sheryl Heron in her first day on the job as the diversity chair, diversity core for the School of Medicine here at Emory University. I also like to thank Dr. Patrick Griffith as well for joining us on the call and working together to move forward with this conversation. So without further ado, I want to try to get started, and I have the impossible task of keeping us on as best a schedule as possible, though I want to hear from each of our panelists, as I'm sure all of our attendees do, on what direction we will be taking as we move forward, not just in the times of social unrest and racial injustice, but how as a department we can be best face forward as we are moving towards that goal. I want to first pull in Ambassador Young, and just given kind of your continued efforts against racism and witnessing the disproportionate acts of violence towards people of color and deaths from COVID-19, can you kind of give us your thoughts on how we will kind of know the current protest and the current efforts against racism are helping us achieve the goal of equity and a truly equitable society and a more perfect union, as has been stated in our Constitution? And I think still muted. I think Ambassador Young, I think you're muted there. Yeah, Cornelia, can you help unmute? I don't have the ability to unmute from here. Yeah, I'll come back and chat. Cornelia, are you able to control the mute buttons?
No, I am not, and we are working on it.
Okay. I'm going to go and move, and I will come back to Ambassador Young. I apologize for our lovely technology that we are using. So I'm going to go to Dr. Satcher and Dr. Harris. Question about how best can governmental and professional organizations kind of help reach the goal of equity with healthcare and research? And we're still muted. Is it something I did over here?
Okay, you should hear me now.
Yes, we can hear you.
Okay, that was my fault. Well, I'm delighted to be able to join you. This is a very important discussion, some very important people. You asked me to introduce myself, and I guess the first thing I should say is that I'm retired. I'm Professor Emeritus of Family and Community Medicine at the Morehouse School of Medicine, and I'm sitting in my office at the Satcher Health Leadership Institute. And most people will say, well, that doesn't sound like you're retired, but I am. Well, this is a very important topic. I think the health of men generally has been an ongoing challenge. Men tend to be less attentive to their health as compared to women. If you look at the population of people who are seen in outpatient care, women always outnumber men. First and foremost, of course, men have some inherent characteristics that contribute to the health challenges. I mean, men have prostate glands, and therefore prostate cancer is a challenge. Men have testosterone, and low testosterone can be a challenge. So you start off by saying being a man inherently, there are some challenges, but there are also some attitudinal challenges in that men are less likely to be seen as outpatients, and therefore when men are seen, they're often in late stages of diseases. So all of those things are challenging to us as it relates to the male population. Now, if you say Black men, and I think I'll say that because it makes a difference. I think Black men have the lowest life expectancy in this country today. Some of you remember the study that we did that was published in 2005 in the Journal of Health Equity. And among other things, we showed that among the Black population, there was an 83,000 excess deaths that occurred in the year 2000 alone. And when we started to examine that, the mortality ratios were striking, and especially as it relates to Black men. The interesting thing was that up until 1980, Black women actually had a major problem with mortality ratios. But in 1980, 2 or 3 things happened. Of course, HIV/AIDS happened, and it disproportionately impacted Black men. But by the same token, in 1980, the drug issue. In our streets throughout the country, many Black men were jailed, families were separated, and it greatly impacted health. And so those are all things that have tended to impact the health of Black men. But there are also some issues that relate to mental health in terms of this society, and we've just finished talking about violence and the violence within our communities, but also violence inflicted upon our communities. And when you're trying to fight COVID-19, and at the same time you have to deal with the other problems related to racism and Black lives, then it becomes a major challenge. And we're dealing with all of that right now. And I think I'll stop there and be happy to respond later.
Thank you very much. And Dr. Harris, as far as with professional organizations trying to do our part of helping with reaching that goal of equity with healthcare and research.
Well, first of all, thank you for inviting me. And I just cannot believe I am on this esteemed panel with all of these esteemed guests. I am Patrice Harris. I'm a child and adolescent psychiatrist here in Atlanta. I am on adjunct faculty at both Morehouse and Emory's departments of psychiatry. I do have to say that I am currently the immediate past president of the American Medical Association, my 1-year term having ended just 2 weeks ago, but of course still on the board as immediate past president, still actively engaged. I'm very happy today to represent the American Medical Association because to your point and to your question, this is an all-in issue, right? Health equity is an all-in issue and it requires stakeholders both within the traditional healthcare ecosystem and external to that ecosystem. And of course, professional organizations have a role to play. And I think the AMA has a particular role to play because we are an umbrella organization representing all states, all specialties, policy. Our policy comes from that diversity of thought and opinion, again, with all states and societies, specialty societies represented. And the AMA has long been engaged in health equity. Right after the report by the then Institute of Medicine, we, along with the National Medical Association, the National Hispanic Medical Association, convened the Commission in Health Disparities. And there was some groundbreaking work there. But a couple of years ago, the AMA, through policy, asked ourselves, what can we do now? What is the next step? And we just established, well, around 2 years ago now, the Center for Health Equity at the American Medical Association. We just hired our first Chief Health Equity Officer, Dr. Aletha Maybank. And we are looking, again, both internally and externally. I'll just say a quick word about internally because Dr. Satcher, of course, knows this well. But for many years, African-American physicians could not join the AMA. And in 2008, the AMA went on record to apologize for that And why is that important? Because as we move forward with all of these issues around reconciliation, you have to first name the problem before you can solve it. And that was a first step, a necessary step, but not sufficient. And so we will be moving forward, addressing health equities. At the AMA, again, we've looked internally. We have a lot more work to do. We will be on that journey, but also partnering externally. Hopefully, and I'll end, many have seen that we made a strong statement. I, along with the chair of the board, this was before we transitioned, made a strong statement against racial injustice. We talked about the many years of structural racism and discrimination that have led to where we are today. And I'll just make one thing specifically about research. And first of all, I congratulate you all because you have to be intentional. If we are going to address health inequities and if we are going to look at research, we have to, again, I meant to name the issue, but we also have to be intentional about solving it. And you all are intentional, first of all, having this conversation and naming it, and intentional about recruitment in research and all the other issues that will require progress on health equities. And finally, the most important concept, and I think Dr. Levey said this, trustworthy actions. We all know, again, and getting back to our internal work at the AMA, we have to build trust. And that requires trustworthy actions. And so professional societies, I know the AMA will be very involved in all of those aspects. And again, look forward to the further discussion.
Absolutely. Thank you very much. And I wanted to come back to you, Ambassador Young.
Can you hear me now?
Absolutely. Thank you very much.
Well, I don't know why I belong here. But I say I have been a faith healer all my life. And the one thing I've always worried about is Alzheimer's. And because it's the one disease where your suffering is projected onto others. And it's not just you. And so I've been very nervous about that and not wanting that to happen. I can take cancer, I can break limbs, so I don't mind suffering. I don't want to make other people suffer. And so I think that's what's drawn me to the Gosweda Research Institute, plus the fact that I really did admire him. And he became the head of Coca-Cola just about the same time I became mayor. And we worked very closely together. But looking at race relations and the things that are happening in our streets now, well, I don't know, but there's something very good happening. That for the first time, I think, people have just become aroused. And I think the trigger was having to watch George Floyd die. And that's an image that you can't get over. It's sort of like the image of the young girl in Vietnam walking down the road nude. On the cover of Life magazine some years back, that when you have to see the horrors of war, when you have to see the horror in police work, something has to be done. But as a former mayor, I didn't want to jump to the conclusion. Well, I didn't want to jump to any conclusions, but the thing that I worry about that's related to us here is that we recruit a lot of young men from the military for our police forces. And I don't know how many of these men who get in these troubles are victims of post-traumatic syndromes from their war days. And because the killings that we read about all seem unnecessary and avoidable. And I don't know how to explain them. We go through what we think is a pretty good training process. But while there's a training process that would teach one to de-escalate a conflict, there's also a tradition in law enforcement that you've got to be tough and you've got to assert your authority. It's an authoritarian personality that ends up in law enforcement. Now, I'm not one of those that thinks you can defund the police. We still have more Black people killing each other in needless gang warfare than we do with police killing Black people. And we still have people killing police. So that law enforcement is a very dangerous profession. But it just leaves me with more questions. And I don't know where we go from here, but it seems as though we're at a place where a number of crises are coinciding. We have the health crisis from the pandemic, and we have the crisis of the economy that's going to put more people on the streets, unemployed, and that's going to create problems. And we don't talk much about it, but we're still living in a climate crisis where the flooding, which normally starts in August and September, started this year. The hurricane started in June. The temperatures in the Arctic are just astronomical. We're in the midst of a time of crisis, and the only thing I can do is maintain my faith that crisis is also an opportunity. And so us talking together and thinking together, dreaming and praying together, you know, is the best I can do right now. But I'm old enough to know that, well, old folks used to tell me that the Lord may not come when you call him, but he's always on time. And I don't know where this coalition of crises is going to lead us, but I'm very glad to be associated with a group of learned people like you that whatever happens, we can take advantage of it and make the most of it.
Absolutely. Thank you very much for those thoughts and that direction for, we know we are moving forward and we are all going to work towards that. And creating a coalition kind of leads into my next question for Dr. Heron and Dr. Griffith, that with the efforts that are going across with racial solidarity happening across multiple organizations, how do you see Emory University School of Medicine and Morehouse School of Medicine continuing to work together to target these efforts to reach health equality?
I believe I should start. First of all, good afternoon, everyone. And thank you so much for this opportunity to share this conversation. It is indeed my pleasure to be here as an emergency medicine physician by training, but I am so grateful to Ambassador Young to talk about faith and as a strong woman of faith. By way of background, you heard in the introduction that today actually is my first day serving as the Associate Dean for Community Engagement, Equity and Inclusion at Emory University School of Medicine, a university I have been at for the last 24 years, serving as an emergency medicine physician at Grady Hospital primarily, which really does lend itself to the discussion around how to partner. I can say that, you know, germane to the title in my new position, note it's around community engagement. And community, in my mind, is inherent to the communities that we have personally as well as professionally. You know, I believe we are all here as humans with the very same thing from when we open our eyes to when we close them on the journey of life, which is to be our best self as what we have been destined to do. And we can't do that without community. And living in Atlanta, and people will hear me say this historically, I came here as an immigrant. I was born in the United States. I was alive when Martin Luther King was assassinated. The same year my parents came to the United States and understood very clearly the foundational realities around education and knowledge of the communities in which we are going to live, pray, work, and commune. And so when you ask about the question related to partnering with Morehouse, you know, I think it's absolutely essential. We are clearly caring for our populations together at Grady, for example, certainly as it's related to this organization. We partner with the communities that we serve in the faith communities to try to reach as it relates to you know, the challenges of Alzheimer's or cognitive disease. I can say that personally, I am one who has members in my family, all three, my mom, my dad, and my father, and my mother-in-law, with varying stages of cognitive decline. And so our communities are personal, right? So I may have a lot of professional titles, but this is a personal investment for me to be involved with this incredible work as we strive to look forward. And in sharing these very real experiences with each other, partnering with each other, learning from one another, we can only be better. And as an emergency medicine physician, I worked last night in seeing over the decades of the trauma that has occurred to Black people, specifically by gunshot wounds, firearm injuries. It is nothing short of disturbing and should be disturbing for all of us. I am one of the co-directors for our Injury Prevention Research Center at Emory, you know, looking at, you know, violence. And we do partner with Morehouse. You know, Dr. Danner, you know, has been on that committee. We're working on publishing and putting out data together through our Violence Prevention Task Force. When you think about Black and Brown people, we partner together in emergency medicine with our Morehouse colleagues for our students and learners who are interested in that arena. And so in those partnerships, as we develop them, everybody wins. Most importantly, our people that we care for, germane to, you know, this conversation looking forward on the impact of Black men who are the epicenter really of families. Certainly in the African community, you think of intersectionality as it relates to our other communities. And so we must work together and continue to open our hearts and our minds across the aisle and determine how we can do so. And I am forever grateful to our colleagues at Morehouse for their vision around that, congratulating them on the grant they just received, over $40 million to look at COVID-19 in the Black community. And those things are to be celebrated. It's not a competition. It is really about caring together as we try to advance the narrative of the realities of racism, police brutality, the underlying stress that Black men and Black families face. That would certainly impact all of our communities. So working together, in my mind, as we forge ahead and continue to do, will be an incredible opportunity for us to change the narrative.
Yes, thank you very much for your thoughts on that. Dr. Griffith, as far as the work balancing between the efforts and the relationships between Emory and Morehouse and continuing those partnerships, how do you see that path forward of working together towards this goal for health equity?
Well, first, I wanted to thank you, the organizers, for inviting me to participate. And I wanted to pick up on several of the leads that have been started. And I'll begin with Ambassador Young. I'm in the same fraternal organization, and I try to be a good Christian. And I think that we're in an environment now in 2020 where we're practicing in dementia-friendly communities, where faith is the core. And so I think that that's important, and that's going to help us because we've been through several serious situations in our history. I wanted to then link to Dr. Heron and share as an Afro-Caribbean descendant, where my mother, who was a nurse, led the chain migration of our family to the United States, specifically to New York. And unfortunately, as she aged, her type 2 diabetes caused her to need to retire and eventually have to get neurological evaluation. At the time, I was not endowed with what I know now. And I remember vividly that when she had to go to a personal care home with my father, who was still alive, the neurologist said, well, she's old, she's Black, she's a woman, there's nothing we can do, just take her home and make her comfortable. That is what has challenged me to do my research to understand two things. One, why do African Americans get more Alzheimer's disease than other African descended people? That's one. And two, why do African American women get more Alzheimer's disease than African American men? And I don't know that either of those two have been settled yet. The third is that we're now living in a situation of the pandemic. And unfortunately, what that's done is that it's heightened the effects of racism, which have been going on in the United States since we were brought here against our will. And so I was hopefully you allow me to quote from a recent paper by Dr. Clyde W. Yancey that came out in JAMA in May. And it reads, the United States has needed a trigger to fully address healthcare disparities. COVID-19 may be that bellwether event. And I feel that that's the key. What's sad is that the COVID-19 and its effects have disproportionately affected African Americans, which is the title of Dr. Yancey's paper. And I think that we need to manage that as a group, and I congratulate my former employees at Morehouse School of Medicine on their grant, as Dr. Heron just did, because I think that they can lead going after this as it affects all racial groups or ethnic groups, but particularly seems to have a double whammy. It affects African-American women and men, and it affects Alzheimer's in those populations, which Dr. Levey has already said is a health disparity. So I will close and wait for questions with another article that came out from a former colleague, Consuelo Hopkins Wilkins, and I can't quote her exactly, but what she's saying is that just increasing the enrollment of African Americans in clinical trials is not the solution to how we go forward with settling both of these problems. So the last is the paper that was highlighted by the Washington Post, which is where I get a lot of my medical information. And it was the reporter talking about a paper from Lancet Psychiatry that was published online in May, and it's titled Psychiatric and Neuropsychiatric Presentations Associated with Severe Coronavirus Infections, a Systemic Review and Meta-Analysis with Comparison to the COVID-19 Pandemic. And what I take away from this, and I was flattered to hear about Dr. Patrice Harris's work and as a psychiatrist. And so I will end with what I gleaned from this paper. The top 3 acute neuropsychiatric complications of severe coronavirus infections are 1, insomnia, 2, anxiety, 3, impaired memory. For those who are blessed to survive, in the post-illness signs and symptoms of severe coronavirus infections, the top 3, 1, fatigue, 2, frequent recall of traumatic memories, 3, impaired memory. And so this is a major problem for our ethnic group, but specifically for all minority groups. And I'm excited that the Office of Minority Health gave the money to Morehouse School of Medicine, who can best lead this attempt to fix what is an ongoing problem. So I'll stop there and be happy to answer questions.
Absolutely. Thank you very much. Again, we are to about the last 20 minutes, and I'm going to kind of keep moving forward. We've been speaking about kind of building a coalition and having a community in the joint efforts, not just for racism, not just against racism, but also towards health equity. And I wanted to pull in Dr. Parker, as well as Ambassador Young, about how do we best build that trust within the community to be an ally regarding research and health goals, not just the subject of the research.
Well, I can start by telling you that since about 2008, it began in 2008, because I was invited or allowed to assist the Department of Neurology at Jim Law's invitation to assist with minority recruitment. And what I learned from women who were mostly retired educators, attending First Congregational Church and several established African-American churches here was, well, we'd be happy to participate, but we'd need more information. And I think you need to have some kind of educational seminar for us. So consistent with what those ladies helped us to do, and these aren't necessarily civil rights icons, but they are to me. They're retired educators, they're retired politicians, and they're women who populate many of our organizations, our sororities, the links. And what we've been continuing for the last 10 years is educating our community about all communities really, but what Alzheimer's is, what it is not. But one of the things that we found was that people needed information about resources. And in addition to the education we try to deliver about dementing disorders and neurodegenerative processes, we have partnered with organizations within the city that provide services, the Alzheimer's Association, the Jewish Foundation, Alzheimer's Foundation of America. We've partnered with a number of organizations that provide services that are needed by people in order for them to just live their lives, not just to participate in research. So in good faith, we've tried to deliver on what it is the community, whether it's a minority community or a European American community, whatever it is you said you needed, we've tried to deliver. And we're going to continue that. And as much as the doctors on this call and any other doctors whose arms we've managed to twist to kind of share their knowledge. And that's what the community at large has seemed to want. If there's more that they want, they need to help us get it and deliver it. So I'm proud of the work that we've been able to do. The fact that we have the people on this webinar today shows that we've been successful in building bridges and trying to talk across our different populations.
Absolutely, thank you very much. And Ambassador Young, as far as the efforts that are ongoing with Emory University building that trust and that and being a strong ally within the community, you have any thoughts towards us like continuing that effort and be forward facing with it?
Well, I think that the organization of support for the Alzheimer's Project has been, from the very beginning, it's been one of the more integrated aspects that I've experienced around Emory. And I think that more and more I run into it now. In fact, I had 4 funerals almost 20 years ago, and all 4 of the men were very good friends of mine. They were, well, 3 of them were physicians, and brilliant gentlemen that after some kind of bone surgery lapsed into Alzheimer's and dementia, and they were in their early 70s. And that scared me to the point where I'm limping around right now because I wouldn't let anybody give me any knee replacement. And I just decided that anesthesia and age don't go together. So I've had operations, but I haven't let them put me to sleep. And I talked with a friend of mine in New Orleans who had the coronavirus, and he's a neurosurgeon. And he said that he refused to get on a ventilator because he took oxygen, but he said that you have to keep your mental faculties going if you get if you're going to beat this disease, and you have to fight it, and you have to be conscious to fight it. So I gave up on ventilators, and I wear my mask, and I try to do other good things. I cannot keep my hands from my face, but I wash them all the time. It's just, I think this is, you almost have to make this a personal struggle. And the more we can talk about it, I enjoy coming to these meetings because I get to pick the brains of all of you good research people. But I don't think there's any harm in personalizing this, instead of acting like, you know, I mean, maybe you're supposed to be clinically objective, but preachers don't have to do that. And we are very subjective, very spiritual, very, well, I don't know, well, there's a fine line in there that that I don't understand the division, and I don't know that I want to. The other thing that I realize in these disparities, there are a lot of disparities that can be changed by drinking water, exercise, and very practical, simple things. And people who stay active tend to live longer. And so that's the reason I'll never turn down one of your calls. I'll never be too busy because the thing I fear most is idleness or not having something to do.
Thank you. We appreciate it.
Very much so. And one of the things that Ambassador Young mentioned was personalizing the efforts. And, you know, as we mentioned, community and coalition and personalizing our efforts, some of that I'm going to kind of direct this towards Dr. Harris and as well as Dr. Heron about how we kind of work towards diversifying our healthcare workforce to better represent our communities and further that advancement in healthcare as well as innovation for research.
Well, I'll just say a couple of things. And I think when we talk about the diversity of the workforce, we really have to get serious about starting, and this may be a surprise, in early childhood. You know, because we need to prepare our students early on so that they can succeed every step of the way, so they are prepared. Now, I always say this, you know, being the first African-American woman to be the president of the American Medical Association, certainly I took with great pride and responsibility the fact that I was tangible evidence that you can succeed. But I also don't believe that we have the luxury of telling children you can be whatever you want to be, because we know in this country that we don't have those equitable opportunities. So we do have to work hard to build systems and supports and structures and preparation early on. And I believe, and I'm a child psychiatrist, so you can, that's my conflict, but I believe we have to start with early childhood and that socio-emotional development, working with parents and caregiver systems. And that of course goes all the way through. And again, we have to support every step of the way. And I know Morehouse has some absolutely fabulous pipeline programs, and we need more support for those. And it's not really, do we do this or do we do that? We have to do it all. And then once we do that, then we have to make sure that we have people of color, Black people around decision-making tables, right? And it's not enough just to get people in. I really like, I think it was Dr. Parker said it's not enough just to bring in research. We have to have the support around that. And that is so important. But we have to make sure that tenure committees are diverse, and promotion and those selection committees for medical school and even undergraduate. So we have to really make sure, I'm glad all of these folks, all of these corporations are making these statements, but the key metric will be the action behind these statements and the accountability. And that's what we have to make sure that there's accountability for all areas, but certainly regarding the commitment to starting in early childhood and making sure that our educational systems are supportive, again, all through entrance to medical school and up through faculty promotion and leadership.
Yeah, and I'll just simply add, quickly, I think Dr. Harris just spoke about the three, leadership, transparency, and accountability, right? LTA, not ATL, yeah, right? Although one can argue the direction doesn't really matter. But, when you think about the pipeline and we know that it must start early, we also have to think about, who's visible in terms of mentorship. If you look at, the 5% realities of Black people, entering into medical school. And I would say that it's healthcare, right? Medical school is one aspiration, but there are so many fields in healthcare that we are absolutely in need of Black and brown people that they can be successful in. And we, we shouldn't think of it's healthcare or, medicine or bust, but there are so many ways in which we can do that. And certainly Emory and other, academic health institutions have the depth and breadth of other healthcare professional attainments that our students could reach. And so in the middle of what, I call, the pandemic, the protests and the politics, right, we have to also remember that our students of color and those of us who are in leadership are sometimes Black taxed, right? We are called upon and have the racial fatigue, it's been studied, to step in, maybe perhaps at the detriment of pursuing research or other things that could advance us in our academic pursuit. So we have to be very mindful, careful, and aware of these realities that we face as Black leaders, but at the same time, serve as a beacon of hope for our Black and brown pipeline, and I call it the bench of people who come up behind us and in leadership. Because without that, I dare say we may still be at the same table we are at 100 years from now without actionable outcomes to demonstrate a change in what we know as the current norm.
And as we're getting close to the end, I know I have just a few short minutes. I wanted to bring Dr. Satcher and Dr. Griffith in and to talk about, as we are all in the position to try to affect the care around us, we know that health disparities contribute to just an unjust and disproportionate burden on people of color. And how do we, as a facility, as a university, as a department, how would we best move forward to help our local environment that then can help change the full community?
So this is Dr. Griffith, and hopefully Dr. Satcher won't mind if I go ahead of him. But I wanted to pick up on what Dr. Harris said as a child psychiatrist, that we've got to start with children. And so there was a neurology paper that just came out, and it's titled, "Living in Racially Segregated Neighborhoods May Not Be Good for Cognitive Health." And I endorse what she's saying. We've got to tell children, Black children, early on that they can be whatever they want to be. But we've got to provide them with the tools to get out of the kinds of ghettos that we end up living in. And so, unfortunately, there's several adjectives that are coming up currently about different kinds of racism. So the particular one about the neighborhood is called geographic racism. There's institutional racism, which is what Dr. Heron and Dr. Harris talked about. There's medical racism, the business about the history of white medical societies not allowing Blacks to participate. So, we've got to know what kinds of things we're trying to fix and do it as a group. So maybe Dr. Satcher didn't mind.
Not at all. You did a great job. I was just remembering when I was director of the CDC back in 1994, we received the report from a commission that had been set up to look at the Tuskegee study and to really ferret out what went wrong and how can we avoid it happening again. And I presented that to President Clinton, who agreed that he needed to apologize on behalf of the nation. And he did. It was May 27, 1996. He did a great job, and he ended by saying that we now needed to ask the Black community to agree to engage with us in research going forward. And he basically said, we admit that we were wrong. Can't imagine how anybody could have done that. But going forward, we need to work together if we're going to make progress in terms of research. And I think the Gus Sweater program with Dr. Park and others has certainly been exemplary in that sense as to how do we come together and overcome a lot of the past. The first thing some people say when you ask them about participating in research studies, including the recent CDC surveillance, antibody surveillance study, they mention Tuskegee. Some of them have trouble pronouncing Tuskegee, but they know enough to be concerned about Tuskegee. We have to keep that in mind because it has to be very clear that we have moved on and that we're determined to make sure that it never happens again. It's a real challenge. Here at the Morehouse School of Medicine, one of the programs with the Satcher Health Leadership Institute that I've always been excited about is our program for parents. We have taken about 100 parents through a 12-week program about child development and how they can better prepare children early on in terms of being prepared for life and learning. I have been impressed with the parents, with their commitment, their dedication to their children and community. But I agree with whoever said they need more support. And I think one of the things that we should do is find a way to better support parents in this community and other communities like it. And it's something that I'm really committed to doing and look forward to working with you on that.
Thank you very much. And I think we're getting close to time. I just wanted to kind of go through some of the major points that we've been discussing and just some of the key words that will show kind of the pieces of this conversation that, again, will lead to trustworthy actions that was mentioned at the start of our conversation. Words like coalition, community partnership, but knowing that these challenges have to be personalized and we have to be held accountable. And we as a department, Department of Neurology, School of Medicine, we want the community to hold us accountable for not just using our words, but to make these trustworthy actions. I would like to ask Andrew Young to kind of lead us out with some words of hope as we're, moving forward the future, knowing that COVID is still present and still rising, knowing that racism still exists, though the efforts are out there to try to end it, but knowing that the work that we have done yesterday, the work we're doing today, and the work in the future still has to move forward.
Well, I was thinking that we were talking a lot about race, and we got a lot of fancy words for it, but I was blessed, and unfortunately, I didn't bless my children the same and grandchildren the same way I was blessed. I grew up 50 yards from the Nazi Party headquarters in New Orleans. And at 4 years old, my daddy said to me, look, these are white supremacists. White supremacy is a sickness. You don't get angry with sick people. You stay out of their way, but you never show fear, and you don't get upset no matter what they say or call you. And he started me off with this mantra: don't get mad, get smart. If you lose your head and get emotional, the blood runs from your head to your fist to your feet, and you do something stupid. Stay calm and think your way through difficulties. He was 5'4". He said, you're not going to be big enough to beat up everybody, so don't go acting bad. But if you stay calm and composed, you can think your way through any difficulty. Now, I thought we were past that when my children came along. And I didn't give my children that lesson, but I got that before kindergarten at 4. And I remember because it was 1936, the year that Jesse Owens won 4 gold medals, and he took me to see that in the movies to show me that Jesse Owens did not get upset when Hitler walked out of the Olympic Stadium. And he said he kept his mind on his business, and the best thing he could do to get even with Hitler was to win 3 more gold medals. And he did that. And I think we've got to teach people not to get, well, to take racism in stride and to deal with it as much as you can, but not let it get you upset. When it comes to medicine, when they were giving out all of this money for viral research, neither Morehouse, Howard, nor Harry got a penny. And somebody gave away $1 billion and gave $100 million to 10 medical schools and left out the 3 medical schools that probably had the most experience and easy access. And so the racism is not just on the streets with the police. I get upset with the medical profession. I mean, it just seems bad for me that we got everything focused on a virus, on a vaccine. Now, I believe in vaccines, but I watched the polio vaccine, you know, from the very beginning. In fact, I was working on the March of Dimes in my first church. And it took us 25 years almost to get to the place. And with the flu vaccines, there's a different one every year. And this virus is going to be even more tricky than influenza. We still don't have an AIDS vaccine. So I'm going to accuse you all of misleading the public when you talk about waiting for a vaccine. There's something else that we can do. Now, that's another long sermon, and I won't bore you with that. But we just have to find, we have to allow ourselves to be free enough to be really creative. And I think the best source of research information is right in here, in your own lives, in your own experiences, and I think if we can get to the place where we're friendly enough and trusting enough together, and I think that was one of the successes of Martin Luther King. He asked for criticism. He encouraged disagreement in the group, and in fact, the only time he got mad with me and upset was when I agreed with everybody. And he stopped the meeting and took me off to the side and said, "Look, you know better than that." He said, "Now, if you're going to be emotional and angry like everybody else, I don't need you. See, I need you to be the Uncle Tom." He said, "Because that gives me, the further you can come down on the right and the more you can argue, the more room I have." He said, "I know my life is in danger." He said, "But I don't want to be way out here somewhere and lose it for nothing. And you have to make sure that you are the opposition to whatever said, to give me room to come down in the middle or somewhere where I am ready. I have the freedom to risk my life." Now, he went on to say, "Look, death is the ultimate democracy. The one thing that is certain is you and everybody else and me, we are going to die. And there's no escaping that. The only thing you have, the only choices you have is, what is it you give your life for?" And so in taking risk, in taking on challenges, find something that you're willing to risk your life on, risk your profession on, push the envelope to the limits, because we really have the whole troubles of the world descending on us. And I thank you for letting me join you. But I'll close with Ralph Abernathy's statement, which was, "I don't know what the future may hold, but I'm not worried because I know who holds the future."
Amen.
And so with that, I'll say, God bless you and keep on keeping on.
Thank you.
Thank you.
Thanks again to all of our wonderful panelists. And I think we can absolutely say that the path forward towards equity involves taking risk. And I thank you very much for everybody's participation.